The next team coming is Padawans. 15 minutes.
Good afternoon, judges, and to one and all present here. We are the Padawans, Shankhanil Chaudhary, myself, Prasanjit Lahiri, and Saurav Chaudhary. So the thing we've tried to do here is target a healthcare problem and worked out a solution for the same. As we see now, the Indian population now is aging. 98 million people are over the age of 60, and by 2050, this number is expected to be 240 million. Also, the shift in diseases is from communicable to non-communicable diseases, example, lifestyle-related diseases like cardiovascular diseases, etc. So, we've done something related to that. Now, our vision is to be the leader in innovation in healthcare and provide product and services for the betterment of the human condition. We understand the value in human relationships and believe technology to be the facilitator for a healthier, happier life. Now, what the medical system actually is, it will be explained by Shankhanil.
Yeah, so the medical alert system is basically an alert system that sends out a message when you are there's a base station that you put in your home, in your premises, and it talks to an end device. The end device is wearable. It may be a bracelet or a pendant. And what this end device does is it has an SOS switch built in it. So when that SOS switch is pressed, it uses Bluetooth to talk to the base station. The base station then has software processing capabilities in it. It runs an emergency protocol, and it sends out messages to your registered hospital, and it sends out messages to your friends, family, neighbors. The reason for the base station, the main reason for having a base station is that we are reducing the complexity of the end device, the wearable device. So it can be as small as possible. It can be waterproof, so you can wear it in the shower. So that's the basic model that we have. Yeah, so as you can see, the two technologies that we will use to communicate is either GSM or the internet. So we can communicate via the internet using an NIC network interface controller, or we can communicate using a GSM modem. So these are the basic three models that we are offering. This is the product pyramid. At the lower end, you have the internet model. That is the base model that runs on the internet, and this service acts like an over-the-top service. On top of that, you have the GSM modem that communicates via the cellular network, and on top of that, you have the biometric monitoring. Yeah, that one. No, the red one. So as you can see, there's a pulse oximeter, a heart rate monitor, blood pressure monitor, temperature sensor, and all of these feed their data into the bracelet, and the bracelet can then send the data to the base station, and it can be sent to a main server that may monitor and record. There can be software to adjust thresholds so that it falls beyond a certain limit. Emergency services can be immediately called. So there are, this has its strengths, and each and every model is catered to a specific audience and has its strengths and weaknesses. So you have the GSM modem. The GSM, actually that technology is ubiquitous now, and the reach is much higher. Also, the GSM is not predicated on a modem, so you don't need a modem. So what happens is, if there is a power cut or a power failure, and you have a backup battery in the GSM modem, then it can communicate and send emergency response irrespective of that. So the internet modem, of course, has its its advantages. As you can see here, as we approach the year 2020, it is the age of the Internet of Things. So many devices will talk to each other, and that gives us a platform for introducing many new services, never before seen services. And as the bandwidth keeps increasing, as we supply more and more bandwidth to the users, we can also have more bandwidth hungry services that we can provide with just basic software tinkering. So we can have medication reminders or medical test reminders, is given to the patient directly. So what we are offering is actually a bundled service. So this is the medical alert system that we talked about. That comes with the medical ID app. The medical ID app is actually an app that the paramedics or the first emergency responders will have. Your medical ID will come with your medical alert system will come with a medical ID imprinted on it. And when you search for this medical ID, it will give you all the critical health information of that particular patient. So the help that you need reaches you on time. On top of that, you get the right kind of help. So this is the basic flow chart. You check the medical ID on the bracelet, input ID into the search field, retrieve and glance through the information, and you can make an informed decision on how the treatment should take place, so that you're not administered drugs you are allergic to. It gives much more insight on why you are facing that particular emergency. We'll just give you a short demo of the medical ID. So at present, that is the base station, that is the bracelet, and when you press the button, you get a immediate. We have 4 settings now, 4 different switches for 4 different things that you may suffering. Maybe you're short, you're feeling short of breath, or you are having a chest pain, etc.
Yeah, so the need for the medical alert system, as I already said, the increasingly aging population and the shift to lifestyle-related diseases. Also, the points of difference. This particular system does exist in the Western countries, but the business model we have thought of is different. The most distinct thing is their system has a BPO. The alert goes out to a call center from where they call back the patient. But we thought that the patient may not be in close proximity to the phone or may not be able to attend it at the time. So we send the alert out to your friends and family and also the hospital, who can immediately dispatch the emergency services. Also, our device is lower in cost and also more energy efficient. Now, the key factors for success is healthcare sector contributes to almost 5.2% of the GDP, and also the private sector contributes to 66% right now, which is expected to grow up to 81% in 2015. Now, the offering that Shankanil already said, we have the medical alert system along with the medical ID app. Now, our USP is this technology hasn't been used in India in this way, and also the Bluetooth low energy is something that saves battery lives, and one battery can go up to a year, so you don't need to worry about the battery running out. The production. We won't be producing the bracelet and the thing, so we'll import the components for the same and we'll just assemble it. Our motto is sourcing, assembling, testing, sales and marketing, and then after sales. Now, so this way we'll save on the manufacturing costs, like machines and stuff that we need. These are the various device components. Our basic strategy is to focus on the niche category and then move on to the broader aspects, like the biometric model that we have. It'll cost a little more, so we are targeting the niche products for the same. But the lower end models, like the internet and the GSM, it'll be targeted to all the regular, to the low income groups as well, so that their reach will be more. Also, since the biometric model is on the top of the product pyramid, that way the profits that come over there will trickle down to finance the lower end models. The pest analysis is done to gauge the environment of the business. So here we see that the Indian government spends considerably less compared to other developing nations in the healthcare sector, but it does encourage FDIs. And so also the technological part is important, because the internet penetration in cities like Bangalore and Ahmedabad is quite high, but it's not the same for the rest of the country. Now, the Porter's 5 forces, it tells us about the attractiveness of the market. Now, if we can see the threat of substitutes and competitive rivalry, there's almost no competitor that serves the exact same thing. So that way, it's a good position to be in for us. So what strengths and weaknesses have already been covered by Shankanil, and these are the opportunities and threats. So we plan on capitalizing on the opportunities and then minimizing all these threats. Moving on, the distribution. We have decided to distribute our product through hospitals. We won't be selling it directly to the customers because we feel that to ensure the help reaches the people on time, it is important for the hospitals to give it out to the customers who stay in close proximity to them. So that way, they, as soon as the alert is sent out, they can dispatch the services. Now, why would the hospitals sell these? We are providing a 15% margin to the hospitals, so they have an additional revenue stream. Also, the hospitals will have a dedicated customer base for the same. Now, the cost. The cost of this particular prototype that we built came out to be approximately 8,000 rupees. Now, if we produce in bulk, we've estimated the price to come out to 2,792. Now, if we are to sell it in the market, we will be selling it for 6,000, including all the capital expenditure that we have incurred and also the overheads. Pricing will follow the elastic pricing, and also the first thing that we'll do is, with the grant money, we'll make 50 prototypes and we'll give 25 prototypes to the government hospitals and 25 to the private hospitals. This will be a test marketing stage, and so the feedback that we receive, that we can find out the demands of the customers and the demand in the market for the product, and also if we need to add any other functionalities or something else. Our target customers, as we mentioned, is the elderly population, patients suffering from cardiovascular diseases, and the individuals who need constant monitoring. Now, risks. We have, our business model has a number of risks. The financial risk is the lack of adequate funding that's available to us. Also, the technological risk cannot be avoided. Battery life, I mean, it has a 1-year battery life, but still it can malfunction. And the equipment failure, network traffic, these are the technological risks. Then we come down to strategic risk, like say the product's supposed to pick up pace in the healthcare sector. That's one. And the operational risk is like assembly process has some faults, stuff like that. And functional risk. The occurrence of false alarms cannot be ruled out. I mean, someone can just press the button and then help arrives, but there's no need for help. So that thing can be misused. But we've tried to keep it to a minimum with the aesthetic ergonomic design. Now, to manage the risk, we've thought that we can easily come into these spheres as well: women safety, child monitoring, because all we need to do is just implement a GPS device on the same GPS component, and with the same components we can make a bracelet for women's safety and also children monitoring. So that's all. Thank you.
I think a challenge is going to be on the demand side. I think in health, really, the demand has not caught up, even for very vulnerable patient populations. But the insurance companies might be more interested, so that they can.
That is also one of our target demographics.
Than patients themselves, unless there are NRIs who want their elderly parents to compulsory wear a bracelet. I don't know, but. Seriously though, the insurance companies, for them, if it means less in-hospital stay payouts, because that's what it could lead to if the hospital agrees and the patient population agrees. That's where, because so that's two points. The third point is, your false alarms thing might be a very serious issue, because you are saying right now you're going to do pulse and heart rate and stuff. I mean, that doesn't give any information. Unless, if I'm about to have a heart attack, that's not enough.
Yeah,
okay,
ma'am,
so what have doctors said to you about this? Is this enough knowledge for them to say, okay, you are critical, I'm going to send you an ambulance in 5 minutes?
Yes, ma'am. The thing is, the pulse rate can go up and down. It can fluctuate, right? The thing that actually is troublesome to a doctor is the gap between pulses. So if you're having that anomaly, and the software monitors that closely. It does not just look at your heart rate can go up for any number of reasons, and if it sends a message, then it's just no use. If your temperature sensor, like the temperature sensor, will send out a message if your temperature also starts going above a particular threshold. That works very straightforward, but for the pulse, you have a different software to monitor that aspect of it. And as for the false alarm system, alarms and all that, we are placing the button on the side of the bracelet, so it reduces a little bit of when you sleep or roll over or whatever. And like you saw in the design, the prototype, what we did was we had different buttons. One button calls, for help, like the medical emergency, you're having an exigent circumstance. Or the other buttons are, maybe they will be forwarded to your physician, because you're having like shortness of breath, or you're just having a little bit of a, difficulty in something. So. That's how we are minimizing the risk of false alarms.
What the percentage of false alarms are in, in when this service is offered in Western countries?
Uh,
And what is the nature of some of the false
See,
alarms?
According to them, the false alarms, because they don't immediately call for help. Because what they do is when when you press the button, a call center executive from their trained executive, they call you back. So then they can talk to you because the base station is actually like a cordless phone on speaker. So when they call you, they can ask you if it's a genuine alarm or not. But since this system is automated and we are ruling out that section completely, because also we don't have a centralized emergency service response system in India, so it has to be funneled through the hospitals in order to dispatch this. So yeah.
And have you thought about who would pay for the false alarms, or who would bear the cost in the case that that a team is sent out, and
since we're distributing through the hospitals, I think that would be their overhead because they are the ones sending out the response team.
And that's something that have you
It's
talked to
something
the
we are
hospitals
actually
about?
working on improving.
Okay.
We also have an idea that the alarm has to be pressed for a particular threshold.
Right.
Like if you activate it by accident, that's a different thing. But if you have to press it, keep pressing it for like 5 seconds or something, then it sends it means a genuine response is required.
And then, and just one last question is, what kind of information systems is kind of the minimum requirement for a hospital to be able to use the information that comes in on that? And how many hospitals actually have that in place now?
Yeah, a lot of hospitals, even like Manipal and all, they already have their database. So when we are looking at the perspective of the app, the critical data information, that can be linked to a person's existing database. So the overheads there aren't, most hospitals have that facility, even more so because the FDI investment is increasing. There are more and more hospitals coming into the place, so competition is fierce. So when you provide this service, that will also, one more point there is that it will also regulate itself in quality, because you will have hospitals competing with each other for providing better service.
But are these hospital information systems relatively interchangeable? I mean, if this is an emergency product, then even if you're a member of MIAT, you might end up at an Apollo.
This will be
so
on our
this is
server.
translatable across MIAT,
Across
Apollo,
all, across all hospitals, everything. This is just the critical. That's why we're not, we don't have detailed health information. We just have the critical. Are you diabetic? Yes, you are. Are you allergic to this particular rifampicin or whatever? This medication? Yes, you are. So all of this information is essential, because you come and you administer help. Even if help gets there on time, there can be misdiagnosis, and it just leads to a very sad situation. So.
While I'm happy to see that you looked at the issue of power outage and such specifically Indian conditions, it didn't strike me as something that I would be interested in if I were responsible for, let's say, public health levels in unauthorized colonies in my city. Or would it? Am I wrong in assuming this? This strikes me as being a cardiovascularly driven industrial society type of diseases, panic button system.
No, you can also use it for Alzheimer's or dementia, and you have a lot of, you can reach out to a lot of people with disabilities who have gotten themselves into a difficult, situation. So this is, this market is wide. Yeah, we can tailor it to a user's need. And also the, as we said, the biometric model, that is a high-end model. So, and the profits from that will trickle down to the other models, and we can, partner with different hospitals to provide them to lower, the extremely low income groups.
Incentivized to want this kind of thing, because are they short of emergency situations? They seem to me not even capable of dealing with the emergencies they have. So, your assumption is that hospitals are saying, oh good, there are some more emergency is there now, let's bring them into our...
Yeah, but this is like you said, ma'am, this is also a monitoring device that gives your physician in that particular hospital a more holistic view of this person's health. So, you know, even the physicians in the hospital that are catering to this particular patient are well informed because of the monitoring system. As well as far as the basic service goes, yeah, it is, when you look at the brand image and the fierce competition and the need for innovation in this sector, I feel that yes, they will be
Heading there.
incentivized to make an effort at least to, you know, reach that 5 minutes earlier, or, you know, that really makes a
I think
difference.
what I like, I don't know, we are, I think a bit away from getting to where your model will really scale. But I think the fact that it allows a user, so if I buy it, I can say, if my mother-in-law is not well, friends network or family network that can be
Exactly.
alerted in the first circle.
Exactly.
The next circle can be the physician circle or the
Exactly. So
hospital
if you
circle.
fall down in your bathroom and emergency services cannot access you, and if your neighbor has the key to your apartment, he can immediately come and help you. Yeah. So
Thank you.
any other questions? Thank you.